I think I know everybody here, but if you don't know me, my name is Mark Belanger, and I work for all of you as the IDN, and am charged with helping you bring the IT systems and the data underneath your projects. I want to spend a little bit of time talking about the successes and where we are and the challenges, and this is like the short version. The successes, as you've heard with many of the projects here, we now have the availability of the shared care plan platform from CMT. It's available, it's being used by, Michelle's our first person to use it. It is working, and it does some pretty neat stuff, but again, it's very simple and designed for coordination of your teams. That's up and running. Alongside that, it looks like the same thing, but there's an event notification system underneath CMT. So what that means is right now, Michelle can run a report that tells her who is current, and I might be ahead of where you are, but it can tell her who is roomed at Cheshire, Valley, and Mary Hitchcock, okay? So in real time, she can know as a care coordinator if any of her cohort is inpatient or in an ED. It also notifies her and her team when somebody is admitted and when they're discharged. We're about a millimeter away from adding Alice Peck Day to that list and New London Hospital to that list. And we recently started conversations at the state level to bring New Hampshire Hospital in there. So for those of you who are used to having your patients disappear into a black hole for months, you'll now have an opportunity to see when they're transferred into New Hampshire Hospital and when they are coming back out, so you can arrange those pieces. So that's in the success column. Right now we have direct secure messaging deployed with a few community partners. Thank you. It's kind of like getting a phone and wondering who else is going to get a phone. So there are a few partners here, community partners that have phones, and they're ready for you to communicate to them. For all of you who are medical providers, most of your EHR systems are capable of direct secure messaging. So it's a matter of getting that communication going. It's not necessary. You could keep doing this fax, mail, bicycle, any way you want, but it is a secure channel for you to start communicating when you're ready to do that with your community partners, okay? We've bought enough licenses to hook up, I think, 50 different community partners in your community. So we've got a lot of infrastructure there to offer you if you think it'll be valuable, okay? The third piece is we've got a big push was made with a deadline of today to do quality reporting. So some of the projects that have been on the ground for a while were reporting clinical quality metrics to the state, and we've successfully brought in clinical data from, I think, 6 different partners, and are right now crunching the numbers to report to DHHS and to CMS on clinical quality improvement. This is still in the pilot phase. We're not quite we're starting into baselining for measures, and this will go under what Lynn is starting to talk about later this afternoon. But that's up and running. Thank you to those of you who worked really hard on that. In the past, it's less than 24 hours, we've made a big step forward with quality reporting in Part 2 patients. We finalized a way to have the quality reports include our Part 2 patients in a way that protects their privacy but still has them count for measurement. For those of you who just signed contracts, I've got some more in my bag just to switch with you. I'm looking at the two of you and to Barbara. We're going to have you just switch out that BAA, and it will now include an agreement that covers both HIPAA and 42 CFR Part 2. Okay? And then I want to thank the folks that came from the MCOs today. We're right at the beginning of bridging in this area, and the MCOs have, it does have flaws, but they have data. They have a lot more data than we have, and they've got gap data that covers where, as you heard the panel, they've got they've got some data that we haven't built up yet from our clinical systems. And there's a real opportunity. The two MCOs that are here have demonstrated their platforms. Those are available to all of you who are clinical folks, and to log into those and to use them to help understand your patient cohort, risk, lots of different things there. They're excited to help, and I think there are ways that we can start working back and forth together. Okay? On the challenges side of the list, many of you have been spending days and weeks thinking about Part 2 and how we get balance with protecting privacy for our substance use disorder patients and how we comply with the law. At the same time, how do we do enhanced care coordination? And those two things don't line up very well at all. We have made some progress with the agreements to help with that, and we're still trying to help with the consent forms. Every one of you has your own legal processes. You've got forms that are not just for your Medicaid, but for your entire populations. And it's not an easy ship to turn to get those forms to comply both with the new Part 2 rules that came out a year ago and to make this all work well for coordination. So we'll continue to help you with those, but just know that when you hit that part of any of your projects, it's like hitting a quicksand patch for a while. And we'll do whatever we can to help you through that. For example, West Central right now has patients that they're ready to share with. Everything's set up. They've got the people ready, the process. Michelle's been introduced to everybody. Everything's ready to go, and they say, okay, who do I put in the to whom column of my Part 2 form? And the brakes come on because you can't do anything until that's figured out. Okay? So that's a very concrete example of something we have to solve together with legal counsel working in cohort with your own privacy folks. Okay? The other piece that I put it in the challenge category, but it's not really a challenge. It's where is it appropriate to bring IT up and underneath what you're doing? I've loved the fact that today has been very focused on people and interactions between people and integration and team building and how do you get awareness of another team that's seeing your patients and all of that. I'm really encouraged that that's where the lead kind of our integration work. There's been a lot of great tool building and process work that's gone along with that. And I really like that IT is the caboose. And I think that's the right order to go with. Everything is live right now. It's ready to come up under your projects. And it's really, please work with me and with Jamie to determine when it really is appropriate to have a successful IT launch in a way that just kind of brings in the data, brings in the communication, and brings in some extra kind of coordination resources for you. We're ready to bring that in whenever you are.